All right, recording has started, everyone. Thank you all for being here. Looking forward to this presentation today, this webinar today, where we're going to dig into what it takes to build a digital front door inside of Cerner Millennium. Thank you for joining. If you're watching this on the recorded version later, we also appreciate you. This presentation is going to split into two parts. The first part, we're going to get into the specifics of what it takes to build a digital front door. What are the fundamental steps? What are the fundamental principles? What, as an organization, do you need to be thinking about as you're engaging in your digital front door strategy? This has been talked about ad nauseum in the last 5 years, the consumerization of healthcare. Most of the applications, most of the tools we use, most of the industries we interact with on a day-to-day basis are fully digital. I can probably count on one hand the number of times I've stepped into a bank in the last 3 years, and that's true for so many of us. So those trends have happened in every other industry. Our patients have become accustomed to having a digital experience, being able to interact with their industry, business, their partners, whatever, through a digital mechanism. And now the pressure is on healthcare organizations, on the hospitals and health systems to say, all right, we've got to build our own digital front door because consumers are now expecting it. And that generation of consumer that has been accustomed to that for the last 20 years, they're now getting to the age in their life where they're starting to use healthcare services. So everyone's been talking about it. We know, I probably don't have to tell you how important this is to have a digital strategy for your patients. So we're going to get into the specifics of how to build your digital front door. There is a Q&A section. So if you have any questions, please put those into the Q&A section, or you can put those in the chat. We'd be happy to answer that. If you're watching the recording of this after the fact and you've got questions, you can email us at contact@calvient.com. We answer those questions as well. All right, there are 5 fundamental steps to building a digital front door. Now, you could say there's a lot more than that, and that's probably true. But if you distill down some of the high priorities as an organization that you got to think about as we're building out our digital front door, as we're building out our patient engagement experience, you can distill that down to 5 fundamental steps. And from there, you'll branch out into other topics, other areas. Number 1, you've got to make your website work for patients and providers. And we're going to get into these in more detail. Number 2, you have to prioritize finding a doctor and booking appointments on your website. Number 3, you have to streamline communication. You need to have a unified communication experience for both your staff and for your patients. Number 4, you need to identify the key metrics that will help you build and track the success of your digital experience. And number 5, you have to adopt a scientific approach to improving that process over and over. It's just like a building. You don't just build a front door and let it sit on the hinges forever. You sometimes got to put a fresh coat of paint on it. Sometimes you've got to adjust it, apply some grease to it. So a digital front door, a digital experience is like that. It requires improvement over time. We're going to jump into these 5 things one at a time, and then we're going to get into the specifics of how Cerner Millennium and your engagement with Cerner Millennium can enable you to build this digital front door, to build an experience that patients have come to expect in every other industry and are now coming to expect from healthcare organizations. First of all, number 1, step 1, starts with your website. And they always say when in sales or when in any type of hospitality services that you only have one shot at a first impression. And consumers tend to make up their mind within the first minute or so what they think about a particular institution or a particular person or organization. And that's certainly true of a health system too. So you've got one shot at a first impression. And over 70% of patients are reporting that they use the internet to find their doctor. They're going to Google, they're reading reviews, they're landing on your website, they're reading about your organization, and they're making up their mind in the first minute or so of that interaction, what they think about you, whether or not you're a good fit. Can I book an appointment? Can I do what I need to do to interact with this institution? So step 1, make your website work for both patients and providers. So a digital front door isn't just a door for patients. You have also providers that are coming to your website that are looking at, how do I send over a referral? How do I send over information, clinical documents? How can I interact with this institution? So think about all those things as you're putting together this plan. We've got to build a website. We've got to emphasize a website that works for patients and providers. A rule that you should live by as you're building out your website is the one-click rule. Any interaction that's important for you as an organization. So we want our patients to book an appointment, or we want our referring providers to be able to submit their information. That needs to be one click away. We need our patients to get to their patient portal. It needs to be one click away. Don't leave it 3 or 4 menus down. It will never be found. Patients won't find it. So you got one shot at a first impression. Step one with any digital front door project is you've got to make your website work for patients and providers. A lot of times the EHR will come along and say, well, your digital front door is your patient portal, and then your patient portal is 3 or 4 links away off your homepage. That's not a front door. That's an inside door, 3 or 4 steps into the facility. The front door is the website. You got to prioritize that. Step number 2, you've got to prioritize finding a doctor and booking appointments through your website. This is a part of that trend we talked about, the rapid consumerization of healthcare. It's created all kinds of reasons you need to do this. I'm sure you know what they are, but here's just a couple. Patients are searching for providers on Google, and having a find a doctor feature on your website makes it far easier for patients to find a provider through Google. They can search cardiologist or endocrinologist or whatever, or family care, primary care in the city of Pittsburgh, Pennsylvania. And Google's going to be indexing your website and building their information on on where these doctors are. And if you don't have a robust find a doctor feature on your website, you're going to put yourself behind the 8 ball. Another reason, and this is important, I think we should dwell on this for a second. 70% of users state they prefer to book their appointment online. And I got the link down here at the bottom to that research. 70% of patients are saying, I would rather book an appointment online than pick up the phone or show up at the front office, whatever we got to do. They say, I want to book an appointment online. That number is only going up. And so it's a critical feature for your organization's website that patients can find a doctor, find a physician, find the care they're looking for, and book it online without having to pick up a phone. Another reason this is becoming more and more critical, especially as patients that are more technology enabled, they expect a consumer-focused experience. They're tending to do this type of thing in the evening. Once they get home from work, they're sitting on the sofa, they're scrolling their phone, they need to book an appointment. They don't want to call and leave a voicemail. They want to go to a website and book that. 70% of users state that, and that's only going north of there. So as you're thinking about your own organization's digital front door strategy, step 1, focus on your website. You've got to make that website appealing. But step 2, make it easy to find and book an appointment with your providers or to obtain treatment from your organization online. Step 3, now we're going to get into specifics with regard to Cerner Millennium in just a moment, but we want to get through these fundamental steps first. Step 3, streamline communication channels to your patients. A digital front door is not just about that first contact. It's not just about landing on the website and finding a doctor, booking an appointment. It's not about that appointment reminder that's going out that I'm sure your organization's doing, that phone call, that text message, that email. That's important. But a digital front door is not just about the first contact. It's about every contact that your organization is making with a patient. And there's some really important information that's actually come out of the federal government, some research about how patients are expecting to interact with institutions. Over 85% of patients prefer text messages, SMS, to portal messages. And 92% have stated that a text they received prevented them from having to call the office. Now let's start with that first number. 85% of patients say, I'd rather get an SMS message on my phone than log into a patient portal. I'm in that 85%. I have patient portals with multiple providers. Some are on Cerner, some are on other EHRs. Having to install the app and remember my username and password for all of those providers across the different providers that I see, that's a pain. And I probably don't have it installed on my phone. And so if I don't get that push notification, or if I don't check that email, or if it goes into my junk folder and I don't see that, it's just not a valuable mechanism for me. And so patients are saying, I don't want to use the portal messenger. I've got too many patient portals. I got to remember my username. I got to remember my password. I've got to have all these apps installed on my phone. That's a bad experience for patients. So our recommendation is when you select a vendor to help communicate to patients, you need to prioritize communicating to patients like they're a regular human. If they want a text message, send them a text message. If they want an email, send them an email. And so pick a vendor, a partner that can enable that. And then from there, streamline your communications across all the various touch points in the care cycle. So from those initial appointment reminders to paperwork, a document, we need to get your signature on this form, and you can text it and they can sign it right from their phone without a username, without a password. You're on the wait list and hey, we got an opening that's opened up. Do you want to accept to move your appointment up, 2 months because we have something open for you. Do that through text message, automatic. Send that have the system send that to the patient, have them reply, yep, that's good, and have the system automatically update, just like two humans would communicate. Lab test updates, important notices. Hey, the office is going to be closed due to inclement weather. Those kind of messages. Streamline that, simplify that for not only for your patients, that's good for them. They're saying overwhelmingly they want that, but that makes it a lot easier for your staff because they don't have to pick up the phone or remember, all right, I got to email this person or log into this other system. It needs to all be embedded inside that EHR experience. We're going to come to that in just a moment. And make sure that every message is tracked. It's very important. It's not only important just for the reporting and analytics of it, it's actually a patient safety thing. You need to make sure all of that's being tracked. Step 4, identify key metrics and track them real time. It's really important as you launch a digital front door project. A digital front door is not just slapping up 4 walls and throwing on a door and expecting things to go well. There's a requirement that we understand how the patients are using the system, how providers are using the system, how staff are using the system. Can we make improvements? Can we iterate on improvements, make our fundamental numbers better? And so something I'll ask you all. You don't have to answer it. You could just chew on this. Do you know what your organization's no-show rate is, or cancellation rate, or utilization rate? And if you do know, how up to date is that information? Is it a quarter behind? Is it a month behind? Can you get that in real time? Can you see in real time when a physician is being over or underutilized? Because from there, you can start to make informed decisions about, all right, we need to start sending 2 text message reminders, or we need to start sending another automatic phone call reminder, or maybe we need to start thinking about automating the wait list for a provider that has issues with their utilization rate. You need that data. You need it real time. And it's a mistake that organizations make is they take the reporting and analytic capabilities and they say, we'll solve that later. We'll roll it out. We'll launch. We'll figure out the data later. What happens though when you do that is you don't have any way of measuring the success of your implementation. You roll it out, but what percentage of patients are actually completing their paperwork online from home? What percentage of patients are not showing up for their visit or are becoming lost to follow or are stuck on the wait list forever and aren't getting updates? So that's critical information. You don't know as an organization if we've made a successful investment in a patient engagement digital front door platform if you can't get that data in real time. So prioritize getting the key metrics and tracking them. And step 5, adopt a scientific approach. Before I came to Calvient, I spent a lot of time in a healthcare institution, a hospital system, and I've frequently dealt with vendors, and it was very often that we would have a term that we would use, or I would use, I don't know if other people adopted it, but we'd have drive-by implementations. We'd have folks come through, they'd stand up a system, and then they'd head on out, and we didn't get the tools we needed to maintain that system or to improve that system. Anytime we had to engage, we had to go find the people who originally built the system and hope and pray that they were still with the organization that implemented it. Don't let vendors get away with handing you the tools, the bills, but no plan for continually optimizing this system. So you got to ask questions like, do our patient satisfaction scores improve for the cohort of patients that are filling out their paperwork online? Are they reporting higher satisfaction scores? You need to be able to know that data, like we said in step 4, but you need to think scientifically about it. All right, we know that this cohort, they're filling out their paperwork 1 or 2 days before their visit. They report better satisfaction. They spend less time in the office. Their wait time is less, and they're giving us better scores on press game. If I know that information, then I can start to say, all right, let's maybe send them 2 text messages or an email saying, hey, fill out your paperwork online. Emphasize that, or in some way incentivize them to do that. You get scientific data, and you start making those incremental approaches to constantly improve. And what you're going to find, we've seen this. You're going to see that no-show rate that's 8 to 12% national average go down to sub 5%. And you're going to. We had a client that was sending out their reminder text messages the morning of the visit for patients that had afternoon visits. And we ran some numbers. We did kind of a little scientific experiment. We found that, hey, if we send that at 7 p.m. the night before or 6 p.m. the night before, instead of at 7 a.m. the morning of, you're going to see a 0.35% reduction in the no-show rate among that cohort. Now, you might think, well, that's small, that's insignificant. But over the course of the year for an organization this size, it was 1,000 appointments that weren't going to no-show. based on some scientific research we were doing with that data. That's important. Don't just erect the building and put up the door, but maintain this and make it better and incrementally improve operations at your organization. Now, all of this is fundamental. I'm building a digital front door. That's all great. These are 5 steps. It's important. It's helpful to know. But how can I do all of this in Cerner? You know, if we were on maybe some other EHR, you might be thinking maybe they've got tools to help with this, but how do I do all of this in Cerner? You know, you might go to Oracle and Oracle says, okay, well, for reminders, you need to go buy vendor A. For your text messaging, you need an on-demand messaging, you need to buy vendor B. For your online intake, that's vendor C. For online bill pay, you know, that's vendor D, and on down the list. For phone calls, that may be another vendor, and you've got a Frankenstack. You've got all these partners that don't talk together, they don't integrate together. They're strung together on HL7 interfaces that go down all the time, that are finicky, that, you know, about 90% success posting rate. That's not a strategy. We don't do that for any other technologies we engage with. We expect to have a single system, a single platform. I don't walk in through 5 front doors at an institution, but for some reason that's become the norm in healthcare technology. And so how can I do this all in Cerner where I have a vendor consolidated approach, a single vendor, a single platform that can do all of this and that's fundamentally integrated? And that's where Calvient comes in. And that's where our product named Channels comes in. So really quickly on this slide, you'll see all of these modules within the Channels platform, our patient engagement digital front door platform, that all integrate seamlessly with Cerner. Before the visit, that's online scheduling, that's reminders, that's online intake, that's your paperwork, online insurance verification, website chat. On the day of the visit, e-check-in, scan a QR code. I was at a doctor's office recently where I had filled out my paperwork online, I was done, and then I came to the office and I was waiting in line at the check-in desk for 5 to 10 minutes waiting on someone who was in front of me. It'd be great if I could just have scanned a barcode, I'm checked in, I go sit down. Why else would I have done my paperwork online? Telehealth, integration into the chart. We're going to show this in just a moment. Bill pay, after the visit, surveys, broadcasting, individual messenger, and automated wait list. All of that in a single platform. You don't have to buy the 5 vendors. You buy a single platform for a single price, vendor consolidated. It's a better experience for you. It's a better experience for your patients. That's a lot cheaper for you in the long run. How does it work with Cerner? The first time I logged into Cerner Millennium was on October 31st, 2005. And the Cerner sign-on screen was purple and it had a bunch of zeros and ones on it. Looked very different. The power chart logo looked something like a planet. It didn't look at all like this P you see right here. Other folks here on the Calvient team have worked with Cerner forever. We have former Cerner engineers on our team. We work with Cerner and we built the Channels platform just for Cerner clients. And so when we talk about integration, we're not talking about a typical integration where it may or may not work. It's strung together by a bunch of HL7 interfaces that may or may not work. We're talking about direct integration with Cerner that doesn't go down, that doesn't fail, that works all the time. And the way that would work is as your patients are completing their paperwork online, as their insurance verifications happening, as they're responding to their reminders, you know, they get the automatic phone call, press 1 to confirm, or they can reply to the email or text. As all of that happens, PDFs, signed documents, scanned insurance cards, scanned driver's license, patient IDs, all automatically interface into the Cerner Millennium database. They show up in whatever folder or whatever area in the chart you want them to show up. Discrete data, so the patient says, all right, I need to update my smoking status, or I need to update my family history. My father passed away of a heart attack. He was 92. I need that to go into the Cerner family history component automatically. All of that direct integrates into the chart where it shows up in your workflow in PowerChart. You can, with one click, approve it and integrate that into the chart. So a few screenshots to show that. For the front desk, here's how it looks. I'm sitting at the front desk. I get this pop-up. You can see it says M pages right here. This is a real screenshot from a test patient. You can see that the patient had this information in Cerner, but online they submitted this information. And so with one click, I can update these, or down in the bottom right, I can click update all in Cerner, boom, updated in Cerner. We don't automatically update the Millennium record without a human setting eyes on that. And I'm sure you understand why and appreciate that. Patients, you never know what they might be typing in. So you look at the data, you click with one click, update in Cerner, instantly updated in Cerner. On the clinical side, so that's at the front office, at the front desk. But back in the clinic room, whenever the medical assistant or the nurse or even the physician is going through the in-page workflow, these are in-page screenshots, we add buttons like this: load online data. You can click a button, it automatically fills out your forms with what the patient submitted online. Here is a review of systems. The patient filled it out online, and with one click, boom, sets your review of systems. Now, what's really cool on this for the review of systems is when the physician starts their note in dynamic documentation, all of this information is already filled out because the patient submitted it and it flowed naturally into Millennium. It saves the front office time. It saves the doctor so much time from having to go through and complete these review of systems, or to check this information like family history and surgical history and smoking status, and the social history, all the information that someone is manually capturing, manually entering into Power Forms around an in-page workflow, fully automated, directly integrated into Cerner. For patient communication, you've recognized this. This is PowerChart. For patient communication, embedded into PowerChart is our messaging app. And so from here, I can select a patient, I can fill out a message, and I can hit send, and it sends a HIPAA-compliant text message to the patient. If the patient responds, it shows back up. So you don't have to log into you don't have to go into the message center and start an email that's going to go to the patient portal. And when they reply, it shows up over there. It's all here in the context of the patient chart. You can send messages. You can also send internal messages. So let's say that a patient has a message that comes in and they say, hey, I need to refill this medication. You're not sure what you should do. You could send an internal message to another person in the Cerner system. They can see it and reply to it, all in this integrated messaging platform. A lot of organizations will pay for messengers like Tiger Text. They may pay for something like Dash Chat to communicate with the patient. They may have ease to send intraoperative notifications to the patient's family. All of that is a part of the single Calvient channel solution. When we set out to build channels, our vision was this. We were tired of having to find 5 or 6 different vendors to serve the basic digital front door needs of a Cerner Millennium shop. We want one platform that does it all for a single fee. It's easy to implement, directly integrated. That was our dream. That was our vision. And that's what we've built. So I hope this has been a helpful presentation for you. Building a digital front door is it's a tremendous undertaking, a huge project. There's a lot to it. But by bringing all of those modules together into a single platform, just like Cerner did when they built Millennium years ago, they brought in their radiology and laboratory and surgery and their PM and revenue. They brought it all into a single platform. That's really what needs to happen in the digital front door patient engagement space. You have all these one-off vendors doing these one-off things. Bring it together into a single platform that truly integrates. So if you're a Cerner Millennium shop, we are the Calvient Channels is the only patient engagement digital front door platform built just for you. Well, I appreciate you joining today. If you've got any questions, feel free to drop them in the chat. I haven't been following the chat, but we'd be happy to answer any questions in chat or in Q&A. Like I said, we've also recorded this presentation. So if you have any questions, feel free to email me here on the screen if you're watching this after the fact. Appreciate you guys. Appreciate your time today. I don't see any questions, so we'll go ahead and wrap up early, give you a few minutes of your day back, and we'll send you out an email for all of the attendees of the recording of this video. Thank you so much.